Good evening. I am your host, Shameika Rhymes, and welcome to Soulibration. I am so excited about tonight's show. But first, let me know in the chat where you are watching from and how you're doing this evening. And remember, share this with your network because I know I am not the only one dealing with hot flashes, night sweats, mood swings, and on and on and on. So if you have any questions at all tonight, drop it in the chat because you guys are the co-hosts. And I already see Asheville, Gastonia. Welcome, y'all. All right. So October is Menopause Awareness Month. And so tonight on Celebration, we're going to have an honest conversation about what it really means to go through menopause. We're not going to, tiptoe around the change. We're going to we're going to take a deep dive into it. So from the first signs of perimenopause to life after the change, we're going to unpack the physical, the emotional, and even the intimate parts of this transition. And I'm so excited about tonight's guest, but I'll introduce them in just a second. So we're going to replace hopefully some of your confusion with some clarity tonight and talk openly about what's happening to our bodies, our relationships, and our sense of self through each stage of menopause. So like I said, let me introduce you to tonight's guest. Dr. Joyelle Ballard. She is known as the Menopause Mogul. She's a trailblazing figure in menopause health and entrepreneurship. She's a board certified OBGYN, menopause, and midlife wellness strategist and business coach. And I'm just really excited about her. She also is the best-selling author of Loving Me, Myself, and Her Through Perimenopause and Beyond. Let's welcome Dr. Ballard.
Hello, hello.
Hello. We've also got Dr. Larissa Ferdinand. She's an OBGYN as well, board certified women's health expert specializing in menopause and integrative care. She's the founder and CEO of Thrive Beyond Wellness Center in Orlando, Florida. So welcome. And then we've got our patient advocate and patient, Shelly Cheyenne. Shelly Cheyenne is a seasoned higher education professional. She's the author of the guided journal, Empower the Limitless Greatness Within You in 21 Days. And she's also my co-host on our podcast, Ladies Edition Podcast. So y'all check that out. All right. Welcome, y'all. So I thought that I would start this question out with all of you. So we'll just do kind of a round table. And then and throughout the show, if there's any time you want to jump in and answer, just tell me to be quiet and jump in and answer. So I know Shelly's good at that.
I sure am. I can't wait.
So, Dr. Ballard, I'm going to start with you. Why do you think menopause, obviously it's something we all will experience, is still so misunderstood, mismanaged, and hard to talk about?
Oh, where do we begin? I think it really starts with the anti-aging culture that we are all conditioned to subscribe to. Like, oh my gosh, you're aging woman, you're in menopause, like this whole big to do about, and it's the end of your life, the doom and gloom. So nobody wants to talk about it. And then it also stokes fear, a lot of uncertainty, and a lot of women are out here struggling in silence and feeling isolated. So I think it's like kind of a gamut of multiple things that, over the generations that we just don't talk about it. We keep it to ourselves. And I think also it goes with just women in general. We're taught to not talk about our bodies. So, for now, menopause is a whole new stage of life and so many different things are happening to our body. Like, no, we don't want to talk about that. But yes, we do. And that's why we're here. So I think it kind of starts with, that.
Okay. I think that is absolutely correct. And I think only now, because it's going national with celebrities like Halle Berry, Oprah, and they're talking about it. So now people are starting to come around like, well, I guess I could tell you a little bit. Dr. Ferdinand, what do you think? Why do you think menopause is so misunderstood, mismanaged, and hard to talk about?
I think a huge word is normalizing. I think oftentimes we're just, hey, I'll just deal with it. Or we've had a particular experience with our clinician or provider or someone we trust at some point, especially in reproductive health, and I know this is not around the conversation, but a lot of people have had some kind of traumatic experience in the healthcare journey. And then You don't have like Dr. Joyelle was talking about. There's not. I don't remember sitting on a couch and my mom talking about. Okay, so we're gonna have a period party. You know, like this is a whole new game changing experience when I see people posting about like, oh, and so I think we've gotten to a place where we're not normalizing what we, deem as normal. As anything, the pandemic has allowed us to shift what is normal really and pivot accordingly. But I think a big word there is we've learned to normalize and we'll just deal with it and et cetera. And then that kind of definitely caps the conversation of what is going on in our bodies and being able to share openly about it, not only amongst each other, which I'm very happy of the revolution that's going on right now. And then what happens when we actually are in front of someone that is willing to help.
Yes, and that's so funny you brought up period parties. I never heard of it till I was watching something on Netflix, and I'm like, "What is this?"
Like, I got shanked when I was younger.
Right. Yeah. No parties over here.
None, none. So, Shelley, as you are, you vocally talked about it on Ladies Edition. You are going through menopause, but why do you think that it is something that is hard to talk about?
I think for me, I was in denial that I was going through it. And because I didn't have any idea of the different stages. Who knew there's all these different stages? My mother only said menopause. She didn't talk about peri. She didn't talk about post. She didn't talk about none of it. She just said, if she talked about it, menopause. So I was rolling in my 30s thinking, oh, I see these little changes going on and little weight popping up that I used to be able to keep down. Didn't have any understanding of it, didn't really question it, didn't know any better. So I think that is also why there's a lot of my friends in my age range who are still in denial that they are actually either in post or peri, or well, those that are in post should know that, but in peri, they're in denial, and I'm standing there talking to them knowing we do what we do, and they're like, girl, that is it hot here? No, sis, it's 50 degrees in this room. That is you, and here's why. And I've just become this this advocate for, hey, did you know about peri? Did you know when it starts? So I think it's just us having the understanding of the different stages and what to look out for and what is the symptom, because there's 900 and some odd symptoms, and keeping track of that and understanding our bodies. Like many of us don't pay attention to our bodies and the changes. We just kind of roll with it. So that's why I think.
Okay, all right, you're right. We'll get to symptoms soon. And I see Charlotte checking into the chat as well. Welcome. So, Dr. Joyo, when you hear about symptoms, like for example, like anxiety, there's cycle changes, sleep issues in perimenopause. What stands out to you? I mean, and on, like Shelley said, 900 other symptoms. What stands out to you about how often women just honestly, like Shelley said, they don't realize what's happening?
Yeah, like Shelley said, there's a lot of women in denial. I mean, I honestly, as an OBGYN, was in denial when my symptoms started at the tender age of 39. So yeah, it's all of it is about, like Shelley said, about being more aware of our bodies. And with, perimenopause, menopause, a lot of women, they hear about hot flash, so they don't hear about all the other stuff, all the other 899 symptoms. But there's at least over 40 symptoms of perimenopause, menopause. And many hear about hot flash, but they don't hear about the other things, the changes in their cycles, the anxiety, the depression, the mood irritability, the rage, the genital urinary syndrome of menopause, which is the vaginal and urinary symptoms. So they're like, okay, what is all of this? But at the same time, need to be aware that this is a change and being proactive about, figuring out what this is and what they need to do in order to feel better, in their skin.
Now run that back. The urinary what? This is a new
So
one.
that's a new one. Okay. Let me explain.
No.
It's called it's GSM, genital urinary syndrome of menopause. So that consists of the genital or the vaginal symptoms and the urinary symptoms that can happen with menopause. So that's your vaginal dryness, pain, even with intercourse, recurring urinary tract infections, pain on the outside of the vulva, dryness in that area. So those are the different type of symptoms down below that we deem as GSM or genital urinary syndrome in menopause. Now, what I want to say about that also, comparing that to hot flashes typically improve over time. Symptoms in the GSM or the genital urinary system, they actually worsen over time. So if you're experiencing any of those type of symptoms, you need to be addressed as soon as possible, as opposed to kind of waiting around to see if it kind of improves with it by itself.
Okay. I see a question in the chat, and Dr. Ferdinand, I'm going to lob this one to you. Lynette McCallum wants to know, how do you know if you're in perimenopause or menopause?
Good question. So we'll just go back to clean definition. So
Okay.
menopause is you have an absence of a menstrual cycle for 12 months. Then the most of the time heading into that period of absence of 12 months is actually a time where you may have constellation of many of the symptoms that Dr. Doyle has already mentioned. So think of menopause as a milestone, not a disease. Every woman is going to go through it, whether she has a uterus or not. That time or that transition prior to the absence of a cycle for 12 months is actually the most common time that you will start having symptoms. And we consider that transitional period perimenopause. So around the time where you're heading into menopause. And especially when we're talking about Black women, we may tend to have more frequency of symptoms, start menopause or perimenopause earlier, overlooked a lot in the healthcare system because may not be thinking that the symptoms that we're having are a condition of fluctuations of hormones. And so that's two of the main hormones, estrogen and progesterone, are involved, and they impact everything. So when we're talking about the constellation of systems, we're talking about symptoms, we're talking about the different systems in our body, from our skin, our brain, our heart, our musculoskeletal system, our vajayjay, what we just talked about. It involves everything when we're talking about this transition and the fluctuations and the highs and lows. I think the biggest component that I want to just really share with everyone is start being aware. I think we get so busy and end up taking care of other people that a lot of times we may even notice things, but we put it on the back burner or when we get to it, or once again, normalizing like, oh, okay, I
Mhm.
guess this might be part of it. But starting to track some of the things that are happening around the time, because when I started seeing women, they're probably in their mid 40s, but most of the time their symptoms have been going on much longer than that. So as Dr. Joya had mentioned, around 39, you have a lot of women who are starting to notice sleep deprivation. A lot of times you may not even have hot flush, and you don't have to be in perimenopause or heading into menopause thinking that you have to have a hot flush. A lot of some 60% of women are going to end up with some kind of sleep deficit or deprivation symptoms. That's when you're going to notice some of more of that weight gain around the midsection, noticing drops in your libido, knowing that, okay, I'm not as clear, I'm not as sharp, and I take care of a lot of different spectrum of women. And I asked them, how would you describe it? It's just like, I don't feel like I'm on my stuff. I'm gonna keep this G-rated today, Shameika,
Yeah.
but I don't think what they're saying. I don't feel like, so what's up? So I think there's an area of looking at it from, this is a multi-system event that
Mhm.
impacts us emotionally, mentally, physically. And what we're finding out, 20% of our workforce are women. So it is something that it impacts the dollar as well. So understanding that it's something that we want to be aware, and most importantly, act when you notice those things happening.
Ooh, because the sleep deprivation, I'm glad you mentioned that, because the shift that I worked in TV news, I went from working 1 a.m. to 9 a.m., then 8 to 5, and then 1 p.m. to 10 p.m. So I just assumed, oh, I'm just not sleeping because my sleep schedule is messed up, not even equating it to this. And
Mm-hmm.
until a doctor said, how's your sleep? And I was like, fine. And she's like, how often are you sleeping?
Mm-hmm.
I can take mini naps. So it was like, oh, let's check your hormones. And she was like, yeah, no, this your hormones are off. So Shelly, I wanted to talk to you because you are, like I mentioned before, in menopause. So what has been the biggest difference between the symptoms you experienced in perimenopause versus the ones that you're facing now? Because I saw you
Um,
raise your hand when she mentioned hot flashes, like you're not
well,
experiencing those.
that's what I was looking out for the
Mhm.
whole time and never had one until 2020. So, and I was 46 in 2020. So, I um had always noticed my sleep was off, especially in my 30s. I would, really wake up about 3 o'clock in the morning consistently. That became my time to wake up. I would literally just wake up, like my eyes were open, like, okay, girl, it's time to start your day. So what we gonna do? Well, let's read the Bible, talk to Jesus, and or go work out. Like that was my norm. So I didn't think anything differently. And then as I went through my 30s, it began the next thing was the little weight. It just inched a little bit. I didn't have to. I used to just stay on the treadmill, do a little cute cardio, what I called it. And I saw that wasn't working no more. So I had to add some other stuff to it. So really now in menopause, the first sign for me was not the hot flashes. I'm a night sweater anyway. I'm filled with heat and love at night. Okay, so I
Sorry, y'all. I didn't
overheat.
mean to roll my eyes.
Don't start around company. But so I'm a hot sleeper anyway. So I couldn't tell by when everyone was talking about, oh, you don't get hot sweats at night. No, because I'm already sweating at night. I've always been like that. But it was literally I was sitting in a meeting at work, and I work in higher education. So, we're throwing around big words, small words, all the words. Okay. And I couldn't think of this very small, it was like registration. It was something so small that I literally could not think of the word. And I started thinking, like, oh my God. So luckily a coworker of mine, she just kind of picked up and figured it out and finished the statement for me. But I was so perplexed about that. And then I started noticing the brain fog. I had it bad 2 years ago. It was so bad that I thought I was having like maybe some Alzheimer going on or dementia. And then of course I went down the rabbit hole of research, WebMD. That's my friend, that's my boo sometimes. He's not right all the time, but you know. So I went and I started looking, and there it was. Oh yeah, you got onset, early onset. You early this. I said, oh Lord Jesus, well let me start doing all the things that I want to do before I can't no more. Then it didn't dawn on me until I started asking my family. I said, did my mom have that? She didn't. My father's side didn't have that. Um, and it wasn't until we started talking about menopause and just the different things we were going through where our research began. And we went down the rabbit hole of menopause symptoms. And that was number 2 or 3. And I said, okay, thank you, Lord, because it's not that. It's not that I'm, losing it, because I was considering quitting my job. I said, I'm in a position that I have to be on, for my students. I can't sit there and just be like, duh, I can't do that. Either I'm gonna have to quit or they're gonna fire me. So, but that's what I suffered with the most. The hot flash I didn't really get until 2020, and I literally felt it real quick and then it went away. And I remember asking my mother, I said, I think I just had a hot flash or a pre-stroke. I call it a pre-stroke because I didn't know what it was. And again, I'm in my 40s now at the time, and I didn't know what a hot flash felt like because my mother never talked about that. She just endured. They that generation was strong. Okay, the baby boomers, bless all of them, because they just tolerated
Yeah.
and just did without. But
Mhm.
so it's a lot of those feelings and symptoms that I had, and then it just kind of progressed from there with the hair loss, the wig. It may not look like it, but this is a lot of zhuzhin, okay? But the hair loss, and I'm funny about my hair because I've always had hair out to here, and it
Mhm.
was coming out, shedding like crazy. I thought I didn't know what was going on. So these are all the symptoms that I started having as I've gotten into the menopause, and after, really after the hysterectomy, it just boom, it just started.
Okay. I'll get to you guys in the chat in just a second, but I'm also curious, what symptoms have you guys in the chat been experiencing? Dr. Joelle, we know, like we've mentioned, there's the symptoms like the mood swings, night sweats, and even we didn't really mention this, but the low libido. Now we know that those things can often strain relationships, like, well, not the low libido part, unless you're doing stuff at work with that you shouldn't be doing, but at work, relationships with coworkers, and then relationships at home, whether it's your husband or partner. What are there any like practical communication strategies that women can use so that their partners and husbands and even coworkers understand, like, I promise you, I'm not always this evil, or I'm not like this all the time, but I'm going through something.
I think just simply acknowledging it, right?
Mhm.
I think a lot of women, try to hide it. I honestly did a lot of pretending, like I'm fine, I'm doing fine, and so I think the first thing is actually acknowledging to yourself and having an on conversation with yourself, and then having to be a little vulnerable, right? To then now speak to someone else about it. Even there's a lot of women out there who really don't feel comfortable still talking to their husbands or partners about different things that are going on with their bodies. So now having to be vulnerable and talk about this with their partners can be very difficult. But if they give themselves permission to do that and really communicate to them, okay, I know you may think I'm crazy, but I promise you that I'm not. I'm on this journey, this midlife journey of figuring out what's going on with my body, and invite them to actually learn with you about the symptoms of perimenopause and menopause and what potentially, you can expect and what they can expect from you in this journey, and allow them to support you, because a lot of partners, they do want to support, but they don't know how because you're not communicating with them. So I just first having to have the conversation and being vulnerable to actually have the conversation, after you acknowledging what's, things are changing, and being comfortable, and even also promote talking over with your children. I have small kids, that they know about perimenopause, menopause, because mommy be going through some things sometimes. So and they need to know. So again, going back to also normalizing the conversation and not having it to be like, a whisper. Like, this menopause is not just a woman thing. It happens to everybody. So it affects all relationships that we're in, whether it's our partners, our children, our colleagues at work. So having, finding a safe space with your partner, finding a safe space with someone at work also, just to normalize the conversation, I think it helps.
I absolutely agree. Actually, I just had a coworker yesterday. She mentioned how she was feeling now that she found a doctor that would listen, and I was like, "What do I do? What do I say?" Because I was like, we don't talk like this normally, but she felt comfortable enough to tell me, and I was like, "Oh yeah, I do talk about this stuff." So maybe that's what it was, but it was nice that she opened up, like, yeah, I was evil, a few months ago, so I'm just letting you know this is why. It looks like in the chat, all the symptoms that we mentioned, most people have said, I have all those. So, Dr. Ferdinand, let's see, Denise Lewis is wanting to know, how long does menopause last?
So when we talk about like menopause, the absence of a cycle for 12 months, then that's just it. You're menopausal, right?
Hmm.
So everything after that is kind of like just saying postmenopause.
Oh,
So, and the thing is, I'm going to take a different pivot, only because I see so many women who have suffered so long because they're not sure. Okay, I'm not sure if I was in this stage or not. Where I want to change the conversation and navigate it to, when you start noticing these things, just know you could still be menstruating. All right. You could have had a hysterectomy long time ago and felt fine, at a certain age. And then all of a sudden, you start feeling something off. So I think that's important, because I think many times we may wait to a certain extent, like, oh, okay, I don't have a period anymore. Then okay, I think I might be in menopause, and so therefore I'm having these symptoms. But it might have been something that was integrated and causing a wreck of your life for a very long time prior to that time. So so that's the most straightforward answer to that. And pivoting to, many of these things are going to start happening before potentially the end of your menstrual cycle. Actually, irregular bleeding, heavy bleeding, lighter bleeding, skipping cycles are one of another hallmark of, yeah, there's some changes, there's some transitions, and oftentimes this is a time where women may have an exacerbation of their fibroids, since we're talking to a big community who are plagued with fibroids, and so end up having worsening of symptoms or bleeding around this time period. And that can impact your quality of life, impact, other medical procedures. Actually, it's around the average time that women may get a hysterectomy. So identifying these things, even despite the term itself, of knowing that many of these things are going to happen even before the absence of a cycle anyway. But directly menopause, absence of a cycle, 12 months, menopause. Everything after, you're after menopause.
I'm like, where were
Can I
you
just
when I was going through fibroids? Nobody explained this.
can I just
Yeah.
ask,
Yes.
Yes.
how long? Okay, so we're in peri and we're going through all of that, and then we finally jump on into menopause, and then we're riding into menopause. Now, do we ride in menopause until we go on to glory? Is that the plan? And if it is, does the symptoms that you have in the early stages of menopause and all of that, do you finally get to the other side? You know what I'm saying? Is there an end of this tunnel where you finally feel like, okay, I was in menopause and everything was falling apart, and now I'm on the other side of that and everything is good again. My body has leveled out. Is there a point when that happens? Give me
Yes.
hope, please.
Yes. Yes.
Okay.
And honestly, it really is. First of all, there's no one size fits all solution. That's
Mhm.
number one. Number two, addressing it in a personalized way means a certain strategy might be more specific to a woman, whether it's hormone therapy or not. I like to address it in a framework. There's foundations, and some of the foundations have to do with the mindset shift. The mindset shift, what you did in your 20s, baby doll, you got to have a different strategy in this time period. That's
Right.
huge, because this is a time where we're dealing with aging parents, kids that may be smaller or leaving the nest. We have a lot of stressors. A lot of times, this is a peak in our career, or we're finally breaking through some ceilings. So there's life is lifing at the time when this biological clock is knocking at your door, signaling these changes. So the approach involves not only nutrition, not only movement, sleep optimization, and then what are the other things you're going to add to what I call the menopausal stack, what becomes your stack or your strategy. But I believe there's joy. I believe every woman has the right. You've lived some great years. The wisdom that's wrapped up in that, the joy that can come from really enveloping and understanding your body, understanding this time in your life. It is a multi-system impact, and a third of your life is going to be there. So absolutely, Shelley, I believe there's joy. I
Thank you.
Yeah.
believe there's wisdom. I believe there's um, uh, just a vision of, hey, I did that, and now I'm here.
Mhm.
Started from the bottom, now I'm here. I don't know, Dr. Joy, if you want to add in. I think
I love that. Yeah, start from the bottom. Now we're here. Yeah, Shelly, they're definitely, and all the other women or whoever's tuning in, there's definitely another side. You will get to the other side. These symptoms that you may be experiencing, they do feel crazy. They feel like I mean, you honestly don't recognize yourself. And I certainly have been there. Let me say that I have been there. I did not recognize myself. I did not like myself, y'all. Like literally did not like myself. But I love myself now. And that came with, I also, when I have these conversations, I always go to the point of us as women, especially Black women, being intentional about pouring into ourselves, especially at this time of life. Because like Dr. Lisa said, there are so many things going on. Life be lifing all the damn time. And if we are not intentional about pouring into ourselves when life outside of us is chaotic, as well as inside of our bodies are trying to figure itself out, we need to be able to still find joy in the midst of all of that, because you will go crazy if you don't be intentional about doing things that you know, find joy in. I say every single day, fill your jug of joy. We talk about filling our cups. We need a jug in midlife. Okay. And filling that jug of joy every single day. Find something that brings you joy every single day. I just, you know, I find so many women, I ask them, what brings you joy? And they're just like stumped. Like, I don't know. Because they're so used to taking care of everybody else and being everything to everybody. And they lose themselves in all of it. So when our bodies are going through these changes, we really have to give ourselves permission to prioritize our joy as we're going through this. And we do get to the other side and, you know, can feel vibrant and feel more powerful as we get to that point.
I love that. What is it? Clock it, whichever finger it is.
Let me go ask my 14 and 12-year-old. I don't know.
We have quite a few questions in the chat, so I want to make sure we get these answered. Missy Lamb wants to know, how come vitamin D levels and ferritin aren't talked about more in reference to this topic? Who wants to take that one? Dr. Joelle, Dr. Ferdinand, which one?
You know, I don't know. I don't know why it's not talked a lot. I know I talk about vitamin D a lot. I consider it a hormone itself, and the basic science of it is part of many major hormonal pathways, metabolic activities that happen in our body so we can function every day, and optimal levels. There are many studies that show how important impact when it comes to immune function, when it comes to hormone balancing and alignment. So it's a very important hormone. Ferritin, I call it, a lot of times your primary care physicians have a basic panel, and then based on then the next level is, what is the diagnosis of the disease, and then it kind of caters to that laboratory after that. But there are other hallmark or biomarkers like ferritin. Ferritin is considered one that you can use not only for looking at someone that may have longstanding anemia, but is also considered an inflammatory marker. So you can judge it a certain way. And I think just to add, I employ communities like this because that's where, boots on the ground, not, pun intended, where a lot of things are built within community. I want to put a shout out to National Menopause Foundation.org, who's building communities for women to share these thoughts, share what, your clinician has said, because you may not have access to that right person just yet. And that builds more knowledge, that builds more fundamentals of what your journey could look like, because we want you to have optimal care for this time of life, because my belief, you heal women, you heal the world. So hopefully that kind of answers, other than I don't know, but being in communities like this, we'll talk about vitamin D and ferritin.
Okay. She had a part two to the question as well, Missy Lamb. She said, what are your thoughts on the Dutch hormone test? What is the Dutch hormone test?
You want me to take that one? Or you
Yeah, you can take that one. Yeah, go ahead.
And you can chime in as well. So the Dutch test is considered a dried urine comprehensive hormonal panel test. It's usually not covered with insurance, but you can use your HSA, FSA toward it. And it's used by a lot of people in the functional health and integrative health arena. And it tells how your hormones are metabolizing. So when you get blood serum tests, you might get, okay, that fraction of time, but this is a test where you're literally collecting urine over 24 hours of different points of the day of how things are metabolizing in your system. And from there, it can be interpreted based on certain pathways or hormone pathways, whether someone may need more of a certain vitamin or supplement. You can potentially dose if you're, with an advanced practitioner who understands how to utilize this test, but it can be a benefit. And how I use the test, oftentimes it might be those who may have other medical issues or problems and on medications, and I want to know like how well they're going to metabolize hormones if I'm given HRT, or someone who's gone to different doctors and they feel like nothing is working, kind of understand. So that's kind of like you really want a precision better of how to address certain things. But it's some value in the test for sure. And I've seen value in the test. Does it have to be done in order to diagnose, treat, manage? No.
Okay.
Right. Yeah, that's what I was. That was going to be my statement in regards to the Dutch testing. When I was in clinical practice, I did not use that test because, like Dr. Larissa said, we don't need it for us to, treat your symptoms and manage your journey as you're kind of, navigating everything. So.
Okay.
I wish I would have known that $500 ago.
Yeah. I'm coming to you, Shelly, in just a second to get your thoughts, but I want to get through this real quick. Renee Morris wants to know, she's 65 and she's still getting hot flashes. Is that normal?
Yeah. So we talked about getting to the other side, right? But there is a small percentage of women who can continue to have hot flashes into their 70s.
No, ma'am.
I'm sorry. There's a small percentage. And will they be as severe as they were when they began? No. But yeah, and that it's normal that it can happen. And now, if you had them and they totally stopped, you were postmenopausal, and they start again, there could be something else going on. Thyroid issues, some other metabolic, condition that can be causing hot flashes. But if you just been, dealing with it since menopause and just continued on, and nothing else really has changed, then yeah, you may be part of that small percentage of women who can continue to have them. And just figuring out, also with hot flashes, figuring out what your triggers might be, whether that's sugar, that may be a glass of wine. Just figuring out that may also be helpful in that regard. So yeah.
Okay.
I wanted to add to and it's a couple of things that I found in women of the beautiful age over 60 and 70. Polypharmacy. By this time, you may have been written different prescriptions, might be taking different things, supplements, etc. So if I see someone, I want to see all your medications. I want to see all of your supplements, because it may be what you're taking. There are different pathways of things that may be interacting, because the aging process may change how your cells deliver and participate in the process of taking this medication, and then there's a reaction from it. So I've eliminated certain medications if someone is over medicated, or realize that it might be a particular supplement that is exacerbating some of their symptoms later on, because this is a high time where polypharmacy may exist, where you're on multiple medications. So it gives you an opportunity to look, take a step back, and instead of narrowing down on, okay, it must be menopause, let's look at some of the foundational things of evaluating the patient and what potentially could be going on. So thank you, Joya, for mentioning thyroid. I mean, that is a huge thing, impacts women the most, and often overlooked as far as how to optimize it. And if you don't, you can give somebody estrogen and progesterone all day. If that thyroid ain't working, you're not going to get the results you want. So it's one that you have to deal with for sure.
I know we're almost out of time, but I wanted to. Do y'all have a few more minutes to hang on because I wanted to hear from
Mhm.
Shelley about because one of the things that I'm seeing this on social media too. A lot of and people in my circle, a lot of issues have been doctors aren't listening when women are coming with okay, this and this and this is going on. Shelley, can you like quickly tell us like kind of what you've been dealing with and how you had to step up as your own advocate till you found someone that would listen, or well, if you have found someone that will listen, I guess.
Well, we're still in the process.
Yeah.
It's like, it's round robbing all these different doctors. My gynecologist who did my hysterectomy said, "Oh no, you're not in menopause. You're not going to be in menopause for a while until you naturally go." Okay, girl, I hit it 3 months after doggone surgery. I was gaining weight by the ton. And she kept saying, "Oh no, that's something else." So I had to go on to a different doctor. I said, "No, one thing I believe in, I'll listen to what you're saying, but I'm going to find somebody else. I'm going to do my research." Went to the Menopause Society website who, they said, "Here's a few doctors in your area who are menopause specialists." And that's what I had to finally learn. Like, you can't just go to one doctor. I was notorious for going to one doctor, my primary care, for everything. Honey, if she could do my pap smear, she did it too. So, I had to learn as I got older, no, you got to go to different people because a gynecologist, she doesn't even understand. Some of them do not always understand menopause, which is mind-boggling. Like, when I went to my gynecologist to have the talk, she looked at me like she was horrified that it was a whole hour conversation. At least I got my copay worth, but it was a whole conversation of her staring at me like she didn't know what to tell me about menopause, about HRT, about any of the things that I was asking. And so I went to the Menopause Society and they recommended someone else who happened to be a doctor in the same office. So this
Oh.
doctor, I said, "I'm going to make an appointment." "I understand you don't understand. I'm going to talk to someone who's certified now." Went to try to get an appointment with her. And she said, "Well, I already saw your file and I agree with what your gynecologist said. That ain't what I came here for." So, of course, me being
Oh.
my mother's daughter who believed in letter writing, I wrote the letter to the Menopause Society and let them understand if you're encouraging women to be advocates for themselves and speak up and get some answers, you got a doctor that's sitting there who won't see me because someone else saw me and said whatever she said. So it is an ongoing situation for me where I'm seeing doctor after doctor to make sure that I'm getting what I'm supposed to get. I'm being heard. And I mean, it's unfortunate that both Shamika and I have had to go through this for years trying to get answers. And then we finally just started doing our own research and taking the answers to them and then, getting what we needed to get. But we're strong advocates of you need to tell these doctors. You need to speak up for yourself. Don't just go by what they tell you the first time. Ask for more information, do your own research beforehand and bring it in to talk to them. So yeah, for me, it has been just me. I'm sitting here now trying to figure out, okay, now I got another doctor. I got to see another doctor about something else for the patch. And I mean, it's just it's an amazing journey, but it is one that has taught me to advocate strongly for myself. And as a Black woman, especially because if we're told anything at all, that's a whole nother show. That's a whole nother show.
Yes, I wanted to get the doctor's feedback on that. Like, and what do you tell women that are watching that are going through the same thing? Like, they cannot get a doctor to hear them and help them with this because you're already irritable and hot and gaining weight and your hair's coming out and your skin's itchy, your ears itch, all the things. what But nobody will help, and so that adds on another layer of frustration. What is your advice for those watching? Because I'm sure they're, and let me know in the chat, are y'all going through that as well? Dr. Joelle, what do you think?
Oh boy. Well, first, Shelley, I'm sorry, and even you, Shamika, I'm sorry that you all have been through that thus far and have not found someone that you have been able to partner with through this journey, because that's what is important, especially in these midlife streets. Um, and we really have to be experts of our own bodies and own that. Um, and unfortunately, we have to doctor shop in this stage of life because of, for me personally, as a physician, when I came out of my residency training, I had very limited, close to none, as far as menopause education. So that's not just me. That's a whole lot of other physicians out there have not had enough of menopause education in their training, in their medical school education. So when they get out here treating patients now, I had to teach myself about how to take care of my perimenopausal patients and how to manage hormone therapy. I had to teach myself. So a lot of physicians are in that same boat because of the lack of medical education and training. Thankfully, they're trying to fix that, but it may take a minute. Okay. So because of that, and not only, I don't think it's only OBGYNs need to be trained. Primary care physicians need to be trained because, like Dr. Larissa had mentioned before, menopause affects multiple body systems. So your cardiologist needs to know about menopause, your primary care doctor, your, orthopedic doctors, like all of these doctors need to know about menopause and how it affects. Estrogen receptors are all throughout our bodies from head to toe. So need to know how it affects our bodies. So the education needs to be go across the board as far as physicians in general. So in the meantime, we definitely have to own the fact that we are our own experts. And if you truly feel that something is different and you need someone to listen to you, you go to a doctor and they're not listening, unfortunately, you do have to doctor shop. And that is crazy that you went to menopause.org and got that response from that physician. I'm like, that's crazy. But what I would normally say is go to that website to find a doctor who specializes in taking care of women in menopause, to find a doctor in your area to start there. But it does require a team of doctors sometimes to take care of you through this journey. But again, also, finding that doctor that is listening, that does see you, and that's also partnering with you, as opposed to just telling you that you fine, or just tell you take this and just send you on your merry way. But having a conversation about what's the best fit for you and go over all your questions and all the things. So yeah.
Okay, Dr. Ferdinand.
Um, y- I love how you say, hey, you're the owner of your health. I use the term, you're the CEO of your health. Now you're looking for your board of directors. It, it, whoever may have delivered your baby, you need to accept that they may not be the doctor for this time of your life. They may or may not, but that is a huge transition because you formed a relationship with this someone. You shared this pivotal time in your life, and then for some reason on this side, they may not be connecting with you. I don't know about you. I shop Walmart, Target, Amazon, whoever's going to give me what I need, right? So I think when it comes to that, the biggest ROI is going to be your health. So why not venture with that person who's going to be able to direct you better as you make those crucial decisions? Go in the office prepared. I recently posted in my newsletter for my community. It's like prompts for your physician, and it's when you're having a dialogue. It's okay. Can you clarify this for me? Let me make sure I understand. Can I repeat that back to you? So if is this what I'm hearing, and you can understand whether that somebody's a good fit that way, because unfortunately, a lot on that boots on the ground, the primary care doctors, the system is complicated and the system is broken. There are a lot of great doctors out there, but they may be overwhelmed because how the system works, everything is funneling back to them. So therefore, either they're deciding to do so or they're referring out. And then part of that. You have 20% of doctors who have actually had some training or feel comfortable with it. Some of them who are still telling people, you need to be scared. I can't do anything. You're going to have a higher risk of cancer. You know, so do your due diligence. There are a lot of good resources, as mentioned, National Menopause Foundation.org, communities such as this, so you can come prepared. So as a CEO, you can make a decision, right?
Yeah.
And you understand whether you already you've tracked your symptoms, you're coming in there informed, and you're not going to be blindsided by the conversation because you feel at least some kind of comfort. Because what I've learned is that there's a lot of anxiety for a lot of patients entering a clinician's office. It is truly a lot of anxiety. And when you break those barriers so you can be an advocate, bring someone along with you. I love it when spouses come on. I mean, because they'll say everything, like so it's these are just different things so you can make more informed decisions and there's no shame in it. There really isn't. I know a lot of times it may be grouped in whoever is covered by your insurance or whoever is a network, but you have to make that decision. Just understand your health is your biggest ROI. And when you put that time and effort in feeling your best, because you can find a joy in this time, you can find peace in this time, but it is a journey, and it shouldn't be a one size fits all journey. So that's my take on that.
This conversation has been so good. The time went by so fast. It really did. I didn't even get to all my questions, so that means you guys will have to come back for sure. Even you, Shelly, you will have to come back.
Yeah, I've enjoyed Shelley.
Yeah, Shelly is she. Yeah, we gotta have Shelly on with us.
Yes, yes.
I've enjoyed y'all.
So,
Getting
for my
done.
last question, and I'm going to start with you, Shelly. What feeds your soul? We gonna find some joy in your jug of joy. Tell me
My
what's in there that
my
feeds your
nugget
soul.
peace. Peace in my pajamas is feeding my soul right now. And that just means while I'm going through menopause, I often say, I'm not gonna battle whatever, work, a man, this, anything outside, and menopause too. Stop, I'm gonna pick a struggle. Okay. So that's what is my joy right
Okay, all right. I like that. All right, here we go. Dr. Joyelle, what feeds your soul?
Quiet time in the morning before the children get up. I wake up, earlier on purpose so I can just sit with myself and God and stretch my body and just be still. That brings me joy.
Oh, y'all got some good ones tonight. Dr. Larissa.
I am definitely practicing. I have to add both of these: surrendering to rest.
Mm.
Yeah.
Um, I have a friend who talks about rest as revolutionary, it's radical, and surrendering to that has been very rewarding. So that brings me joy right now.
I love these answers. Y'all did so good with that. Sometimes I'm like, what are people gonna say? But I like these answers. I want to thank you all for coming on tonight to talk about menopause. I know, as we've discussed, sometimes it's hard to talk about, but it seems like I see a lot of thank yous in the chat saying thank you for talking about this because knowledge is power. I see a lot of thank yous in all caps. So I think we definitely helped some folks out tonight. So thank you all for
Mhm.
coming on.
Thank
For
you.
more information on menopause and the things that we've talked about tonight, you can also head over to blackdoctor.org. There's articles and resources over there. And I hope everybody, including everybody in the chat and you all, have a soul filled rest of the week. Thank you.
Thanks
Thank
for having me.
you.
Okay.
now. Thanks.
Nice meeting you.
Don't hang up.